Our next presentation is Modernizing Regulatory Programs with Comprehensive Strategic Improvement Plans. I would like to introduce Susan Shelton, Food Safety Program Public Health Advisor at the Washington State Department of Health, and Amber English, Environmental Health Supervisor at Washoe County Health District in Nevada. Welcome both of you, and I'll hand it over to you, Susan, first.
Great, thank you very much, Tracinda. All right, so thank you very much for letting me share a little bit of Washington's experience with drafting our strategic plan when we submitted for our recent three-year grant that Maribeth just went over the process. And it was an overwhelming process for us, so I was really thankful again to hear her presentation for us today. So Washington State is it's an excellent place to live and work, but by the numbers, we're actually pretty average. Our population of about 7.5 million people, we're actually 1/50th of the size of the United States. So whenever we look at illness rates for the United States, if we can take out 1/50th of those, and that's about where we are. So again, we're pretty average when it comes to numbers. We have a decentralized public health system in Washington State. We have a mix of local control and several state agencies that oversee retail food safety. The majority, though, the vast majority of retail food safety in Washington is conducted by our 35 local health jurisdictions. They serve 39 counties, but again, we have 35 separate local health. Staff in the local health jurisdictions are generally generalists, regulating several EH programs with fewer than one FTE in food in each of the jurisdictions. However, we have a few agencies that have staff specializing in food safety, and they have 10 or more FTEs in food. Each local health department operates independent of the State Department of Health. You'll have an opportunity throughout the seminar to actually hear from two of our local health jurisdictions. King County and Clark County are both here, and they'll be presenting at the seminar. Several state agencies also have jurisdiction over retail food safety in the state by statute. We at the State Department of Health oversee the state ferry system, colleges, hospitals, and transient accommodations. Our partners at Department of Agriculture primarily oversee wholesale food processors, but they also do retail when they oversee cottage foods, and they also do our custom slaughter. And then we have other state agencies that oversee nursing homes, childcare, and a few other institutions. We all based our retail requirements from a shared food service rule, which was recently revised to adopt a modified version of the 2017 Model Food Code. So I'd like to talk with you about our program's first effort with a strategic plan. While we routinely maintain a program work plan, we really didn't have a lot of experience developing a multi-year strategic plan within our program, which actually caused us quite a bit of concern when it was one of the requirements for our grant. Our agency's grant team, we have a large agency, we have a good sized grant team, and they handle the revenue, the coding, and the document submission into the portal, but otherwise they left the rest of the grant maintenance to us, which caused us quite a bit of a steep learning curve. So I'm going to show you in a moment a snapshot of our strategic plan, but I'd like to show you the 6 key points that we observed from our strategic planning process. The first was that the process was very helpful to us to provide direction and ensure alignment. We had an idea of where we wanted to go with our grant, but we really learned quickly that we're a bit stronger in food safety than we actually are in strategic planning. So we found the strategic planning process help us set priorities, and we also included subtasks in each of our strategic plan to meet each deliverable to make sure we worked to incorporate the standards and missions. Found that the work process actually helped us make sure everything was aligned with both our agency's goals, but then also some of the needs of our stakeholders and also the capacity that we had in our program. It also helped us put meat on the skeleton. We had high hopes when we started our grant, but putting it on paper helped us figure out what it would actually take for us to get to where we wanted to be. It also helped us identify some of the fat that we could easily remove before we started the work. Again, we had a lot of grand plans that we wanted to do when we applied for our grant. We were applying for a 3-year. So we had a lot of options and opportunities that we wanted to start to work on. But then as we put it on paper, we started to see we're not going to be able to do all of this within our 3-year time frame. And ultimately, we also had to trim some of the meat throughout the process as we went through each of the 3 years of the grant. And so having the strategic plan really helped us see where we could safely trim without disrupting the rest of the plan. We used our plan also to monitor staffing hours, timelines, and deliverables. And we liked including the staff resources and the using of the consumables on our version of the plan to help us determine how many hours we'd be able to dedicate for each task. We had 4 grants that were going on simultaneously when we were working on the strategic plan. So this helped us separate the tasks and deliverables for each grant, but it also helped us generate work plans for staff. The plan also helped us maintain situational awareness. We had a lot of moving parts again because we had multiple partners with different timelines that stretched over several years. So having the strategic plan helped us stay on track or return to focus as we had changing priorities. We also had quite a few staffing changes during the timeline of our grant. And so this also helped us maintain a consistent approach and continuing to move forward. Also helped us with grant reporting. We used our strategic plan for regular progress updates internally inside our office and also for our grant reporting. And then finally, the strategic plan really helped us increase accountability, but it was also a nice physical manifestation of all of the different individual tasks that supported the finished work. So it was very motivational to review the strategic plan every time we did a grant update or now when we're writing our final report. So again, we had 6 items that we felt were really helpful with the strategic plan. We developed the strategic plan to support our Project Reach grant. And it's a 3-year grant that we did to increase the number of enrolled jurisdictions in our state and also increase their success toward program improvement. We had several jurisdictions that had been enrolled for several years, but we were starting to find, and to include our program, and we'd stopped progressing. And so we started Project Reach to actually both increase the enrollment, which we did. We went from 18 jurisdictions that were initially enrolled and went up to 30 jurisdictions by the time that our grant was done. So we really did increase the number of enrolled jurisdictions, and then several of the jurisdictions, and to include our program, actually completed quite a few additional standards during this tenure. So let's look at this amazing strategic plan that we developed in order to support the grant. It's this, it's very low tech, it's pretty basic, it's pretty much a spreadsheet. And this is what worked out well for us. As I mentioned in the beginning, we were not experienced grant managers. So this document is a reflection, again, of worked for our program. We're most familiar and comfortable with using Excel. So that's what we developed our strategic plan with. You know, Mary Beth talked about that some people provide a narrative. We initially had a narrative as part of our strategic plan, but it was much more helpful for us to actually itemize items by deliverables. And we, again, used a shared Excel spreadsheet so that we could sort and link and cross-reference multiple sheets and multiples of our grants. So I want to bring attention to a couple things in particular. We listed each of our deliverables. And what we did is we went through each of the standards and identified where, either through our self-assessment, where we had some gaps or where we could continue to bolster our actual work towards standards. And so we listed those by the actual standard number. So each of these is going to potentially have a tie-in to our strategic plan. It's going to have a tie-in to the actual program standards. So that if we meet this, will help us meet that portion of a standard. And then we could then click on those and it would actually link back to another sheet that would help us explain it a little bit more thoroughly. So again, we had each of these and we had an internal numbering system so we could sort them and make sure that we could continue to work forward. We also had a timeline. Several of our timelines were related to activities for other partners, and we had quite a few adjustments throughout our grant cycle. So including the timeline in our Excel format helped us to sort based on whether or not the project needed to have the timeline adjusted. And then we could then look at other timelines that were related to this actual deliverable and see if it affected others. And so having it in a spreadsheet format for us, again, was very helpful to be able to sort so that we could actually rank items. And if we had to move a timeline for one of our deliverables, how many other dominoes that would have to actually fall in order to get that to work. We also tracked the hours and per diem. So we opted to include this on our strategic plan. It helped us figure out how much time that we were able to dedicate to each of these tasks. Also, we would identify the leads for that deliverable. So if we had something that was gapping or something where we had a bit of a delay, we could reach out to the leads. It also helped us, we could use this and then identify work plans for staff through, again, another linked portion of the spreadsheet. And then finally, we also had several pages that we linked so that we could actually click and look at specific standards, deliverables, or also work plans. So my keys are for a successful adventure for you is kind of to follow the Yogi Berra quote. If you don't know where you are going, you're going to end up someplace else. And so our keys for your successful trip are going to be to start early. We had a skeletal strategic plan when we adopted our grant. It was pretty much narrative and it was not accepted. And as Maribeth talked about in the last session, we submitted our materials right up on the day it was due. So I'm going to encourage you, if you're looking to apply for your grant, do the self-assessment, know where you stand, get your strategic plan ready, and then submit well before the actual end date of the grant, because you might have to make some modifications. And the FDA was really helpful for us. They provided a lot of input, a lot of guidance, and we were able to turn in a more successful strategic plan that actually helped us going forward. So again, really highly encourage you to start early. Also, we want to make sure you communicate with partners. Talking with your partners about your goals will help identify any fat on your skeleton that might actually need to be trimmed, areas that you might need to actually better flesh out. You know, as much work as you can do with them in advance would be helpful. And then also make as many on the team involved with your strategic plan as you possibly can. We kind of worked in a silo during ours because, again, we were on a pretty tight crunch. And I think that potentially had others on our team feeling like they missed out on the most important 5 minutes of the movie. So buy-in was always an effort throughout our entire process. So again, get as many on your team involved in the strategic plan as you possibly can. Will really help you as you roll through the system. Again, as Maribeth mentioned, a lot of different systems will work. The spreadsheet is what worked for us really well. We're going to maintain it even going forward, because again, it's really helped us to continue to work on our both our internal materials that we have, but also to make sure that we're meeting the FDA program standards as well. So again, I want to thank you for letting me come and talk to you today, give you a little bit of an update about our process with doing the strategic plan. Here's my contact information in case you want to check in with me. I'll also be here at the conference all week, and so we can connect through Pathable. And then we'll be posting our strategic plan and all of our Project Reach materials in Food Shield Resource Library as soon as we wrap up our final report this month. Thank you very much.
Thank you, Susan. We'll hand it over to Amber.
Hey, thank you, Tricinda, and thank you, Susan. So my name is Amber English, and I am the supervisor of the food safety program in Washoe County. Just not sure if I see my slideshow. There it is. Okay. Oops. Just a second here. Okay. And so I'm going to talk a little bit. I know Susan is at the state level, and so I'm going to talk a little bit just from the local perspective for a local health jurisdiction. Oops. Okay. So before I talk about our experience with strategic planning, I'd like to start with just a brief background of our jurisdiction. So Washoe County is located in the northern portion of Nevada. Borders California to the west and Oregon to the north. We oversee portions of Lake Tahoe and also the city of Reno and the city of Sparks. Our population is about 465,000, and we have approximately 3,600 permitted retail food establishments. And our inspectors are not only, they are generalists, so they're not only doing the food establishment inspections, but they're also doing the facilities, including childcares and schools, public bathing, public accommodation, invasive body decorating. And our division includes one division director, 4 environmental health supervisors, 7 senior environmental health specialists, and 21 environmental health specialist staff that again are doing kind of a little bit of everything. So during this presentation, I want to go over our journey with strategic planning and how a comprehensive plan helped our food safety program achieve our goals. So we enrolled in the program standards in 2004, but we made little progress until about 2013 when we received our first 5-year FDA cooperative agreement. At that time, we also began applying for some of the AFTO funding for projects related to conformance with the program standards. The funding opportunities helped us to build momentum, but our program still lacked an overall focus and direction. What we needed was a plan, because what we were doing is similar to that top left-hand picture where we had multiple projects with multiple staff members going in multiple different directions with different funding sources, without really a specific overall long-term objective. And in 2014, our FDA retail food specialists held a statewide strategic planning workshop. And as a result of this workshop, we were able to identify some long-term objectives related to the program standards that would really bring the most value to our program. So we really wanted to think of what are those things that would really bring the most value to our program and also have the greatest impact on public health in our community. And then we were able to identify on what we wanted to focus on first and develop more of a short-term strategic plan. I'll show you some examples of both our long-term and short-term strategic plans in some subsequent slides. But we also realized that while the funding allowed us to expand our resources and dedicate more staff to work on the program standards, we also needed to garner support and build consensus with our upper management and our Board of Health members. And part of the reason that we were successful in garnering that level of support was our ability to show progress and measure our achievements, which I'll also be explaining in some further slides. So this is an example of our long-term strategic plan for Standard 1. And you know, I know Susan talked about that their strategic planning kind of started as part of their grant funding. We kind of started a strategic plan, just a very basic format as part of our self-assessment that we did in 2016. So what we did was we kind of used this template. It's a basic Word document. I know Susan said that her Excel spreadsheet was low tech. I totally disagree. I thought that was awesome. That's great. And I will be looking for that on Food Shield. But we really just started with a basic Word document, but it still was able to give us the specific tasks. This one, as you see, because it's a more of a long-term plan, it's high tech. It's simple, but it still shows the responsible individuals, includes anticipated due dates and specific deliverables for each tasks. We have a similar 5-year plan for each of the program standards, and we're currently in the process of completing our next self-assessment, and we'll be developing a similar plans for each of the program standards after we identify the gaps during our self-assessment process. And this is an example of how we broke down our long-term plan into a more focused 1-year strategic plan. And I use this example from 2018 because it's a year that we had multiple concurrent projects with different funding sources, and we needed a way to organize and track projects related to the funding source. And we just used a basic color-coded system to identify which projects corresponded to which funding source. Oops. Copy, sorry. But again, we use the same format. This is just another page of the same plan. But again, like I said, we use the same format to track projects by month rather than year, like our long-term plan. As you can see here, the tasks are a little bit more detailed, but they still include the specific dates, specific deliverables, or documents that for each task. And in this plan, we actually also have a column that shows which food safety program standards tasks are related to our overall health district strategic plan, which I'll discuss in a little bit more detail in a minute. And then here's an example of an even more focused, what I guess I would call more of a work plan that relates to our most current 3-year FDA cooperative agreement. When we submitted our progress report in year 1, we did kind of what Mary Beth was talking about, that narrative approach, but we really didn't include the level of detail that was needed. And I think that was probably about the time that Mary Beth took over for the management of the grant, of the cooperative agreement grants. When she received our report, she called us and basically told us she was going to need better from us. She wanted just more details on the activities, the responsible parties, due dates. And once we realized this is what she was looking for, we figured, well, that makes sense. That's easy. That's what we were already doing. We just didn't realize that, we could just put it in the same format for a particular grant project. So this one is, just a more specific plan that just relates to one grant, and it's by year. So each task, again, the tasks are definitely more detailed with specific monthly project completion dates, responsible parties, and that's for all 3 years. And this was updated, each time we submitted a progress report, we just updated this action plan. And as I mentioned earlier, I wanted to touch base on how important it is for the success of your program to build consensus and get buy-in and support from upper management. So this screenshot is an example of our overall Washoe County Health District strategic plan. Because we were able to demonstrate that we had a plan to work towards conformance with the program standards, and we were able to demonstrate that conformance results in a positive public health outcome, we were able to incorporate our program objectives into the overall health district strategic plan, which is seen in the initiatives here. And this not only helps ensure our program and mission is supported, but as Susan kind of mentioned earlier, it also helps keep us accountable. Our program standards initiatives have also helped our organization with public health accreditation efforts, because several of our program standard initiatives were used as examples for measurable continuous improvement projects when we went through our accreditation process. Here's another screenshot of those overall strategic objectives that are tracked through our district's performance management software. This one is a little bit more sophisticated, but it really is just our high-level district strategic plan, and it's also supported by about 3 staff members at the Office of the Health Officer level. So again, we continue to use just those simple Word document formats. And I know that those will also be some templates that are similar will be available, as Mary Beth mentioned, if you reach out to your retail food specialist. And then the final and probably one of the most important aspects of just strategic planning in general is the ability to measure progress and achievements. And one example of how we do this is here at the Washoe County Health District is by using this Excel tracking tool that I know is now, the updated version is now available on the FDA Program Standards website. This is the older version of the tool, but we kind of liked the way that this one looked with the colors, but we will be switching to the new version once we complete our self-assessment this fall. But this visual representation of progress for each standard has been extremely helpful when reporting out our progress within the food safety program and for all of our inspection staff, also for upper management and our regulated community. We've used it in our written communications, our reports to the District Board of Health, and also in our workshops and any meetings where we're communicating just basically our program and our achievements. And then just to wrap up, I want to acknowledge that our efforts in developing a comprehensive strategic plan have paid off, not only with our full conformance with the standards that you see listed here, which were verified through audits, but also with the work that we've done in the last 5 years. We were fortunate enough to have received the 2021 Crumbine Award. And I would say that the work that we've done in the last 5 years has helped build and lay that foundation for continuous improvement. And we still have a long way to go. So we're looking forward to developing our plan for the next 5 years and to keep this positive momentum going. But in addition to just having, I kind of want to wrap up by saying, but in addition to just having those documents that are written down, you have your plan in front of you. It's more than just a piece of paper. It really is important to continue to get that support and buy-in, not only from your staff, but from your management. And with that, I will hand it back over to Tricinda for any questions.
Thank you, Amber. Thank you, Susan. What a great job. We can take a few questions from the audience, so please continue to add your questions in chat. A question for both of you. What were some hurdles that you encountered and how did you overcome them? Susan, would you like to go first?
Yeah, so I think our biggest one is, as Amber mentioned, we did this because it was pretty much required for our grant. I think it would have been much more beneficial to go, let's plan this long term. And I love the concept of from Mary Beth when she was like, use your self-assessment and go, let's put this into a strategic plan. How can we meet each of these? I mean, we should all be doing that in general anyway. And so we're going to, like I said, plan to maintain our strategic plan. We did it designed to meet the need of the grant, which was, I wish we would have had it already. But again, it did help us. And so we are going to continue to maintain it. So we were behind that 8 ball because we did it in response to needing to for the grant. And then we also had a little bit of a time constraint. So just get ahead of the ball. And that's my biggest recommendation.
Thanks, Susan. Amber? Amber, did we lose you? Or are you on mute?
There we go. Okay, it wasn't letting me unmute. So I would say, as far as, challenges and advice, I would say that, we all have competing priorities. There's some that are out of our hands. I know we had a struggle with COVID, but we also had significant staff turnover. And we've had, different division directors, over the last few years with different visions. So I would say just flexibility and not giving up, because there's been many times, and as you saw from one of those last slides, when you see our actual performance management software, there was a lot of red dots, which really is saying that our progress is stalled right now. So I would say that it's really just important to, be flexible and not give up when you have those challenges, because they're going to continue to occur. And maybe just have, backup plans, or, if it's grant funding. I know that Mary Beth has been great. If you have something that you're just not able to accomplish for whatever reason, but you come up with another solution, and just submit that amendment, whatever it is. But, and also just in your plan, even if it's not related to grant funding, just that ability to be flexible, and have the ability to change your plan as your priorities change.
Thank you both. I think we have time for one last question. What types of projects did you use for the grant funds for? And Susan, I don't know if you want to start, or Amber, you're ready.
Oh, so I'll go real quickly. So we actually did something for each of the standards. And so again, we have a pretty small regulatory portion. We provide more guidance to local health and other state partners. But we did a rule revision. So a good portion of ours was adoption of the 2017 Model Food Code. We used our grant to standardize some individuals for standard 2. We used the grant to also prepare compliance and enforcement materials. Also to work on a HACCP guide. We were really looking on how to do retail HACCP a little bit above and beyond for what we traditionally see on the field. We have a lot of special processes in Washington State. We also worked on quite a bit with Standard 5. We actually got verified for Standard 5, which for us was quite a bit of work as well. And then we did some industry outreach. We did quite a bit on each of the standards ultimately.
And ours were similar projects. So we've used grant funding, and not just the cooperative agreement, but I had mentioned that we had a lot of those AFTO grants. We were also part of the NACHO mentorship program. And so we have used the funding for the same thing when we changed or updated our regulations for our outreach, our postcards that went to all our regulated facilities. Standard 2, we've also used for standardization, for training materials, for sending staff to trainings, to various trainings. We've used funding for that. Standard 3, we actually, in 2016, changed our entire food inspection rating system. So we hired a graphic designer to kind of come up with our new, it's a pass, green, yellow, red system. So they kind of developed and kind of rebranded us. And so we use the funding for that. We use the funding for outreach and media campaigns related to our new inspection system. For Standard 4, we actually developed our compliance and enforcement policy as part of the NACHO grant, along with the Southern Nevada Health District. And then I don't know that one of our goals for next period is to use funding for outreach on foodborne illness, how to report foodborne illness. So that's something that we plan for next grant cycle, or the next year, 3 years, depending on what we apply for. And definitely Standard 7, so outreach material. We did a risk factor study in 2017, and we used a lot of our grant funding to develop those intervention strategies that were identified during our risk factor study. So those areas that we knew our facilities needed to improve on, whether that was outreach material, additional training for them or for staff, we've used the grant funding for all of those. So kind of similar to what Susan explained as well.
Wow, thank you so much. I have messages here that your spreadsheets are amazing. This was absolutely so impressive, both of you. So I know that you're both available for other folks to contact you. Please feel free to use the chat, and both of them provided their email addresses. So we'll get that set up if anyone wants to talk to Susan and Amber. Thank you again so much. This was wonderful.